Did you know that something as natural and personal as daily self-pleasure could be quietly influencing your prostate health? It's a topic many shy away from, but it's one worth talking about, especially as we age. For years, researchers have been studying the effects of frequent ejaculation on the prostate, and the findings may surprise you. Is it helpful? Harmful? Does it protect against prostate problems? Or could it increase certain risks? If you're over 50, these are more than just curious questions. They're essential parts of your wellness journey. In this video, we're going to unpack what the science actually says, what doctors want you to know, and how your daily habits could be affecting your health in ways you never expected. We'll also explore what's considered normal, what might be cause for concern, and how to make informed, confident decisions about your body. So if you've ever wondered how something so private could have such a public impact on your well-being, stick around. The truth might not be what you think, but it could change the way you view aging, self-care, and sexual health forever. Welcome to Life Advice for Elders Haven, where we offer honest, science-backed conversations about aging, health, purpose, and everything in between. Today, we're exploring a topic many older men think about, but few ever speak of openly: daily masturbation and its effect on prostate health. This isn't about judgment, taboo, or outdated beliefs. It's about clarity, confidence, and taking ownership of your health with facts, not fear. As we grow older, it's only natural to ask deeper questions about how our habits affect our long-term well-being. You may have heard rumors or conflicting opinions. Some say daily ejaculation is good for your prostate. Others warn it could be harmful. So, what's the truth? In this video, we'll walk through what modern science has uncovered about ejaculation frequency and prostate function. We'll look at surprising findings from long-term studies involving thousands of men, and break it down in a way that's easy to understand without the medical jargon. We'll explore whether frequent ejaculation has a protective effect against prostate cancer, how your sexual habits may influence inflammation and hormone levels, what's considered normal or healthy as you age, when it's time to speak with your doctor, and how to do it without embarrassment. We know this can be a sensitive subject, but here at Life Advice for Elders Haven, we believe no topic is off limits when it comes to helping you age with strength, dignity, and awareness. You've spent a lifetime taking care of others. Now, it's time to take care of yourself, and that starts with understanding your body and honoring its needs. If you're curious about how something as private as daily self-pleasure could be connected to something as serious as prostate health, you're in the right place. Stick with us to the end. You might come away with insights that not only surprise you, but empower you to live with greater intention and wellness in this next chapter of life. Many older men carry private questions about sexual health, but feel too embarrassed or even ashamed to voice them. Perhaps you've wondered in silence, is frequent ejaculation helpful or harmful? Will it lower my cancer risk or raise it? And what, exactly, normal for a man my age? These are honest, important questions, and you are not alone in asking them. With every passing birthday, the body we've known our whole lives begins to change. The prostate can enlarge, hormones shift, energy levels ebb and flow, yet mainstream conversations rarely address how intimacy, solo or shared, fits into this new reality. So we turn to late-night internet searches, whispered chats with old friends, or too often keep the questions bottled up, letting worry grow in the dark. Some men fear that daily self-pleasure is too much. Others wonder if it's actually protective. Many aren't sure how to bring it up with a doctor, or worry they'll be judged for even mentioning it. If that sounds familiar, take a deep breath. Right here, right now, we're making space for an open, judgment-free discussion grounded in science, guided by compassion, and spoken in plain language. You deserve clear answers, free of stigma and outdated myths. Maybe you've felt a dull ache and wondered if it's serious. Maybe a headline about prostate cancer left you anxious, or perhaps you simply miss feeling confident in your own skin. Whatever brought you here, know this: curiosity about your body is a sign of self-respect, not shame. In the next few minutes, we'll replace uncertainty with understanding, and silence with supportive knowledge. By the end of this video, you'll have practical, evidence-based insight to help you decide what's best for your health, your comfort, and your peace of mind. So settle in, you're among friends, and every question you've carried quietly is finally welcome on the table. Section A: Understanding the prostate. I will explain what prostate is, what it does, and how it naturally changes with age. Let's start with the part of the body many men hear about, but few fully understand: the prostate. This small gland, roughly the size of a walnut, sits just below your bladder and wraps gently around the urethra, which is the tube that carries urine out of the body. It may be small, but its job is important. The prostate's main role is to produce a special fluid that nourishes and protects sperm. During ejaculation, this fluid mixes with sperm from the testicles to form semen. It also helps propel that semen out of the body with force and efficiency. So, in essence, the prostate is a key player in male fertility and sexual function. But here's where things get interesting and more relevant as we age. As men grow older, the prostate almost always changes. Starting around the age of 40 or 50, it often begins to enlarge slowly. This condition is known as benign prostatic hyperplasia, or BPH. It's not cancer, and it doesn't always cause problems, but for many men, the changes become noticeable. An enlarging prostate can press against the urethra, making it harder to urinate. You might find yourself having a weaker urine stream, going to the bathroom more often, especially at night, or feeling like you can't fully empty your bladder. These symptoms are common, and in most cases, they can be managed with lifestyle changes or treatment when needed. But that's not all. The prostate can also become inflamed or irritated over time, a condition called prostatitis. Sometimes, it's caused by infection, but often, the exact cause is unclear. It can lead to discomfort, pelvic pain, or trouble urinating. And of course, there's one more concern that's always in the back of many men's minds: prostate cancer. Prostate cancer is one of the most common cancers in older men. The good news is, when caught early, it's often very treatable. That's why regular screening with PSA blood tests and digital rectal exams is recommended starting in your 50s or earlier if you have risk factors. So, to summarize, the prostate supports fertility, but it's also sensitive to age and hormonal changes. It often enlarges naturally with age, which may cause urinary symptoms. Inflammation and cancer are other possible issues, but awareness and regular checkups can make a big difference. Understanding these basics helps lay the groundwork for our next section, where we'll dive into what research says about ejaculation frequency and whether daily masturbation has any real impact on the health of this important gland. Stick with us. The science may surprise you. Section B: The surprising link between ejaculation and prostate health. Now that we understand what the prostate is and how it changes with age, let's explore a question many men ask silently: can regular ejaculation actually protect my prostate? Surprisingly, the answer may be yes. Let's look at one of the most well-known studies on the topic, conducted by researchers at Harvard University and published in the journal European Urology. In this long-term study, over 29,000 men were followed for almost 2 decades. Researchers carefully tracked their lifestyle habits, including how often they ejaculated each month, whether through sex, masturbation, or nighttime emissions. The key finding: men who ejaculated at least 21 times per month had a significantly lower risk of developing prostate cancer compared to those who did so only 4 to 7 times per month. In fact, the study found that those with higher ejaculation frequency had about a 20% lower risk of prostate cancer. Now, let's pause for a moment. Does that mean more is always better? Not necessarily. This research doesn't suggest that men should force or fixate on reaching a certain number. What it does suggest is that regular ejaculation may play a protective role, possibly by flushing out toxins and inflammatory substances from the prostate, reducing stress through natural hormonal shifts, and improving circulation in the pelvic region. These effects could help keep the prostate healthy and reduce the chance of harmful cell buildup. Other smaller studies and clinical observations support this general idea. Although we're still learning about the exact mechanics, Some urologists believe that a regularly active prostate may be less prone to stagnation or inflammation, which could reduce the risk of abnormalities over time. That said, balance and comfort matter most. Every man is different. Some feel good with frequent activity. Others may notice changes in libido, energy, or emotional needs as they age. And that's completely natural. Here's what's important to take away. There's no perfect number, but staying sexually active in whatever way feels right for you could have real health benefits. If you have concerns like discomfort, a sudden drop in libido, or changes in urination, talk to your doctor. It's not embarrassing, it's proactive. So whether you're partnered or single, sexually active or solo, know this. Ejaculation isn't just about pleasure. It might also be part of your prostate wellness routine. When paired with regular checkups, hydration, movement, and a healthy diet, it can be a small but meaningful part of aging confidently and comfortably. Section C. What daily masturbation may do over time. Ejaculating every day can sound either reassuring or worrisome, depending on who you ask. Let's put feelings aside for a moment and look at what the body actually experiences, starting with the potential benefits. Prostate drainage. Regular ejaculation clears built-up prostatic fluid. Think of it as running fresh water through a pipe. It may reduce stagnation and inflammation. Hormone regulation. Orgasms briefly lower the stress hormone cortisol and boost oxytocin and endorphins, nature's mood elevators. Over time, this can foster better sleep, steadier blood pressure, and a calmer mind. Stress relief and pelvic circulation. The rhythmic muscle contractions of climax improve blood flow in the pelvic floor, which may ease mild discomfort from sitting long hours and support bladder control. Those are compelling reasons many doctors say a healthy sex life, solo or partnered, can be part of normal aging. But no habit is risk-free, so let's address the cautions. Overuse or compulsion. If daily masturbation feels driven by anxiety, boredom, or escapes from loneliness and leaves you drained rather than relaxed, it may signal compulsive behavior. Frequency alone isn't the problem. Loss of control is. Physical irritation. Aggressive technique or inadequate lubrication can irritate skin, cause micro tears, or even worsen prostatitis flare-ups. Gentle is better. Relationship or mood impacts. In some men, excessive solo focus can nudge emotional distance from a partner or amplify feelings of isolation. Watch for shifts in mood, social withdrawal, or guilt. Remember, daily habits are only one part of the bigger picture. Diet, stress, exercise, and sleep also matter. A balanced plate, a brisk walk, deep breaths, and 7 solid hours of rest often do more for prostate health than counting ejaculations. If you're thriving, great. If you notice pain, diminished energy, or a sense that the habit rules you, pause and reassess. Talking with a urologist, counselor, or even a trusted friend is a sign of strength, not weakness. Ultimately, the goal is quality, not to quotas. A body that feels comforted, a mind that feels clear, and relationships, starting with the one you have with yourself that feels nourishing. Section D. What doctors recommend. Let's bring this conversation home with the most important part. What do doctors actually recommend? First and foremost, most healthcare professionals agree on this. Don't ignore your prostate health, and don't wait for symptoms to appear before taking action. As you move through your 50s, 60 seconds, and beyond, regular prostate checkups become a key part of staying ahead of potential problems. Here's what that usually includes. A PSA blood test, which measures a protein called prostate-specific antigen. High levels might indicate inflammation, enlargement, or cancer. A digital rectal exam tray, which helps your doctor feel the prostate for abnormalities. In some cases, imaging or further tests, if something unusual is found. These screenings aren't meant to alarm, they're there to inform. Early detection is often the difference between simple management and serious treatment. But beyond screenings, what about daily habits and sexual routines? Doctors generally say that sexual activity, including masturbation, is safe and even beneficial when it feels good, emotionally, and physically. However, they also encourage men to tune into their bodies. If you experience any of the following, it's time to check in with your provider. Persistent pain in the pelvic or lower back area, sudden changes in libido or erectile function, difficulty urinating or increased nighttime trips to the bathroom, a sense that sexual behavior is affecting your mental health. None of these symptoms mean something is wrong with you as a person. They simply mean your body may be asking for support. In fact, many doctors report that men who are open about their sexual health live more comfortably and confidently. You deserve that kind of peace of mind. And here's something we all need to hear more often. Aging doesn't mean giving up intimacy. It means being informed. You can continue enjoying your body, exploring connection, and staying curious at any age. There is no cutoff date for pleasure, closeness, or self-awareness. Whether you're single, partnered, or somewhere in between, the goal is to feel empowered, not ashamed, curious, not confused, and always supported, not alone. Because real health isn't just about avoiding disease. It's about living fully on your terms. We've talked about a topic that often goes unspoken, yet it matters deeply to so many men. What are your thoughts on this? Have you ever quietly wondered about how your sexual habits might impact your prostate or overall well-being? If so, you're not alone, and you're in the right place. We invite you to be part of something rare, an open, respectful, and stigma-free conversation. Whether you have a story to share, a question you've never felt comfortable asking, or simply want to say you're glad this topic is being discussed, you're welcome here. Drop a comment below. We read everyone, and this is a community built on empathy, curiosity, and mutual support. If this video helped you feel more informed or more understood, let us know by giving it a thumbs up. That small gesture helps more people like you find information that matters. And don't forget to subscribe to Life Advice for Elders Haven. Each week, we bring you honest, science-based guidance on topics that often get overlooked, from intimacy and health to purpose, aging, and inner peace. Because growing older should feel like growing wise, not growing invisible. Together, we're building a space where aging is embraced, questions are welcomed, and dignity always comes first. So stay with us, and your journey is far from over. In fact, it might just be getting more meaningful. As we close this conversation, let's remind ourselves of something simple but powerful. Your health journey is personal, and there is absolutely no shame in asking questions or in taking care of yourself in ways that feel right to you. Sexual wellness, prostate health, emotional balance, these aren't fringe topics. They're part of living fully, aging wisely, and owning your story with courage and curiosity. If today's video made you think, or maybe gave you a sense of relief that you're not alone, you've already taken a meaningful step. Aging is not about decline. It's not about disappearing or giving up. It's about living with awareness, with dignity, and with the quiet strength that comes from experience. Here at Life Advice for Elders Haven, we honor that. We believe aging should feel like becoming more, not less. So, as you go forward, remember, stay informed, because knowledge protects you. Stay confident, because your voice matters. And stay connected, because you don't have to navigate this alone. We're here, this community is here, and we can walk this road together, one honest conversation at a time. Until next time, take care of yourself, and thank you for being part of this haven.